Hi, my name is Marcus, and thank you for viewing my final practicum presentation. Within this presentation, I'll be first talking about the history of California Pacific Medical Center, or CPMC. Then I'll be going through the organizational chart and the key leaders of CPMC, and I'll also be talking about the strategic plan that CPMC has in place. Then I'll be discussing the external influences as well as the competitive advantage that CPMC has within the area of San Francisco. Then I'll be talking about the SWOT analysis, or the strengths, weaknesses, opportunities, and threats of CPMC, and also its mission, vision, and values. Then I'll be introducing a system change, which is a cold and compression unit called GR Pro 2.1, and I'll be going over its budget for the first year as well as any other additional costs. Next, I'll be talking about the value statement of CPMC and how this change is linked and how it relates to it, and also introduce any key strategies for implementation. Finally, I'll be going over the strategic plan for the GR Pro 2.1 and how I plan to implement it and evaluate it at the end. And then I'll go over the references, and that should be it. So beginning this presentation, I'll be going over the history of CPMC. So to begin my presentation, I'll be going over the history of CPMC. So CPMC originated as a German hospital and was founded in 1858 during World War I. And it consisted of 4 hospitals, all of which are now renamed into the Davies campus, the Mission Bernal campus, the Van Ness campus, and a few other outpatient clinics that are still open. CPMC does feature a few differences or programs that make them different, such as same-day care, as well as other treatments and services, such as walk-in care, urgent care, video visits, emergency care, and lab draws. We also specialize in primary care and family medicine, pregnancy and childbirth, mental health, women's health, pediatrics, imaging, and mammography. So CPMC actually is not magnet designated, and it is a non-for-profit organization, which means that it is not investor owned. Therefore, any money that's left over after employees and bills have been paid, it's reinvested in healthcare innovation and community benefits. CPMC believes that this community-owned hospital and this not-for-profit approach to healthcare best serves the patients and the communities. According to the Journal of General Internal Medicine, patients treated at a for-profit or government-owned hospitals were 2 to 4 times more likely to suffer preventable adverse events. Whereas being treated at a not-for-profit institution, they would So first, I would like to talk about the history of CPMC. CPMC does offer a few services and programs that make it different than other hospitals, such as same-day care, which includes walk-in care, urgent care, video visits, emergency care, and lab draws. They also feature treatments and services which also differentiates themselves from other hospitals, such as primary care and family medicine, pregnancy and childbirth, mental health, women's health, pediatrics, imaging, and mammography. CPMC was first a German hospital, actually, which was founded in 1858 and is now comprised of 4 hospitals: the Davies Hospital, Mission Bernal Hospital, which was St. Luke's, Van Ness Hospital, and a few outpatient clinics. CPMC is not magnet designated, and it is a not-for-profit organization, which means it's not investor-owned as a healthcare system. Therefore, any money that's left over after employees and bills have been paid is reinvested in healthcare, innovation, and community benefit. So CPMC believes that through a community-owned, not-for-profit approach to healthcare best serves the patients and communities, as patients that were treated at a for-profit hospital were 2 to 4 times more likely to suffer adverse events that were preventable rather than patients that were treated at a not-for-profit institution. Investor-owned for-profit healthcare systems also have financial incentives to avoid caring for uninsured and underinsured patients. They also have incentives to avoid underserved populations in less accessible geographic areas, such as rural areas. Within Northern California's underserved rural communities, Sutter Health is actually the only provider of hospital emergency medical services within those communities. Next, I'll be talking about the organizational structure and the key leaders. I know it's a little small, but if you can see here, we actually designated a new president of our organization, Mr. Warner L. Thomas, and under him, he has the CEO, the COO, CFO, and CCO, as well as a bunch of other officers and managers. Next, I'll be talking about the precepted experience where I did my preceptorship, which was under Jim Benny, who is the Vice President of Surgical Services. Now he is the CNE, or Chief Nurse Executive. And I know, again, it's a little bit small, but under him, he takes care of all of the hospitals, such as the Davies and Mission Bernal, as well as Van Ness. And under him, you can see all of the directors, all of the managers, as well as support services. CPMC is actually different between each hospital. Each hospital gets to decide whether or not they want to be represented by a union. Currently, the hospital that I work at the Davies campus, we are non-unionized, whereas at the Mission Bernal and Van Ness campus, the nurses decided to be represented by a union. So each one is different. Next, I'll be talking about the organization's strategic plan. The mission statement for CPMC is that we enhance the well-being of people in the communities we serve through a not-for-profit commitment to compassion and excellence in healthcare services. So an implementation strategy plan that I found that CPMC has implemented was back in 2019, and it was a community health needs assessment through the hospital. So a few community health needs were identified. I listed them down here below. Food access to coordinated, culturally and linguistically appropriate care and services, food security, healthy eating and active living, housing security and an end to homelessness, safety from violence and trauma, social, emotional, and behavioral health. And they found 4 steps which they can help resolve these issues. through community health status assessments, assessments of prior assessments, community engagements, and health needs identifications and prioritizations. I listed a few examples of actions and resources that the hospital plans to take. That's listed on the right-hand side. And those are just a few examples. There's a lot more that CPMC had planned to use, as well as the impacts that these actions and a plan to evaluate those impacts. So any collaborations that the hospital and organizations that they wanted to use to address those health needs, they included the name of the program, the description, its goals, anticipated outcomes, the metrics that were used to evaluate the program activity and initiative. So within my specific department of the surgical interventions and radiology, as well as following Jim, the chief nurse executive, we are now focusing currently on patient satisfaction, a healthy work environment, and the EOW, as well as communication between management and nursing staff. Next, I'll be talking about some external influences on the organization. There were a few, most recently due to COVID. But because of the different mandates and the different compliances that CPMC had to go through and all hospitals had to go through during COVID, required additional costs for monitoring, security, safety, and supplies, such as PPE, or security at the front doors to make sure that people would check in and would go through checks to make sure that they are COVID safe. Another external influences was Medicare and the insurance costs to the hospital per patient. And then next was the external influences of public data, which would drive the internal quality assurance and measures that the hospital would take. Next, we're discussing the competitive advantage that CPMC has within San Francisco. There weren't many, but CPMC does have an advantage because it's located in the heart of San Francisco and downtown, and typically patients or people that would go through the ER would come to it because they were close to the hospital. Another competitive advantage that CPMC has would be its specialty services, specifically at the Davies campus where I work. We are recognized as a high performer in stroke care, so patients would come to us because of stroke needs. Lastly, we are recognized as an LGBTQ healthcare equality leader, which means that we have equality for all healthcare, for all genders and sex, as well as orientations. But because CPMC was one of the last, or CPMC is located in San Francisco, which is one of the last cities to recover from COVID, many people were able to work from home, meaning that they would move out of San Francisco, which means that they would not seek care at this hospital, unfortunately. A lot of people would leave the city to find cheaper housing because they could work from home. Also, due to the COVID outbreak, tourism was lower, meaning we'd get less admits to our ER, and also COVID shut down a lot of the surgical interventions that we were able to perform because patients weren't really looking for elective surgeries anymore during that time. But hopefully, as the city recovers from COVID and as we become more COVID conscious, we'll be able to reopen all of our services, and people will be able to move back to the city as we reopen our companies. Next, I'll be talking about the SWOT analysis and analyzing the internal environment of where Jim works, where he is the CNE or the Chief Nurse Executive, as well as how he oversees the interventional radiology and surgical services departments. Some of the strengths that I noted in his department was that there was a lot of accountability in patient care. There was a lot of collaboration and goal setting through numerous meetings of higher ups and management. There was increased progress tracking of how their current projects are going and how new projects will be implemented. There was a lot of promotion of self-management within the department so they would promote more self-management of staff such as nurses and assistants. And lastly, they had a big focus on costs and growths, as well as supply and labor and their staffing plan. There were a few weaknesses that they are currently working on. One of the weaknesses was the EOW, which I mentioned before, which is the experience of work within their hospitals, such as for staffing, such as physicians, employees, and patients. So getting more surveys out and being able to respond and acknowledge those surveys was one of the things that they're currently working on, and increasing their EOW percentage. Next, they wanted to create a more healthy work environment between physicians and nurses, as well as nurses to patient and patients in general. Lastly, they're working on their quality dashboard and their communication between management and nursing staff. And next, a few external opportunities that are available to the department is for more rounding on the floors from management. I know it's difficult for management to be able to round on the floors due to time constraints, as well as the many meetings that they go through. But that's one of the opportunities which I've actually heard that staff really appreciates. And it's more visible for staff to see the changes and to have their needs heard through rounding on the floors. Another opportunity that I saw was that there could be more communication and recognition through boards throughout the units. This would help nurses be able to see the progress on any needs that they had, as well as feel recognized for their accomplishments and progress of any projects that they were currently working on. Next, there could be more opportunities for staff involvement, which is almost like the surveys that they're doing, as well as staff's additional roles and responsibilities, and being able to grow through their employment. And lastly, we'll be talking about any threats that was threatening to the internal environment of the organizational. Next, we'll be talking about the threats that were present in the environment that management was in. COVID is one of the main threats that limited in-person meetings. which means that everything has to be done on the phone. This limits a lot of face-to-face, as well as personalities and getting to know staff due to those COVID protocols. COVID also is a threat because it caused a lot of sicknesses and staffing shortages throughout the hospital. Next, we'll be talking about the mission, vision, statement, as well as the philosophy and goals of CPMC. The mission of CPMC is to enhance the well-being of people in the communities we serve through a not-for-profit commitment to compassion and excellence in healthcare services. The vision is that Sutter Health leads the transformation of healthcare to achieve the highest levels of quality, access, and affordability. The philosophy of Sutter Health is that the organization's philosophy of care is that our teammates live Sutter's values on a daily basis as we support and provide high quality, inclusive patient care. Sutter Health's commitments to our values and diversity and inclusion does not stop at our doors. When conduct by our employees outside of work, online or off, impacts our patients, teammates, or organization, we will stand by our commitment to equality and non-discriminatory practices and look into the matter. We value the trust placed in us to provide safe, equitable, compassionate care. When potentially problematic conduct is brought to our attention, we do a thorough review and consider the relevant facts. Our response to such situations may range from education and training to formal corrective action, up to and including separation from employment. We remain committed to providing a safe and inclusive environment to work and receive quality, compassionate health care, where all are treated with dignity and respect regardless of race, gender identity, age, disability, ethnicity, sexual orientation, or religious belief. And then next we'll talk about the values of Sutter Health. So every day Sutter teammates live for our values and deliver exceptional care and service to our patients and communities, which includes quality, innovation, affordability, teamwork, compassion and caring, community, and honesty and integrity. So next I'll be talking about a strategic alternative that will be used in order to help support the fulfillment of the organization's strategic plan, basically to help support the well-being of people in the community, as well as the patients through the healthcare services that CPMC provides. And this alternative that I'm introducing is the cold and compression therapy unit, specifically by Game Ready. The unit is called the GR Pro 2.1, and it is a cold and compression therapy unit, which is active cryotherapy, which also includes intermittent compression, circumferential coverage, faster and deeper cooling, and it is portable. So active cryotherapy means that it is rapidly circulating ice water consistently, continuously, and comfortably, which helps to cool the affected site for total arthroplasty knee patients, and also helps to reduce swelling, edema, muscle pains, as well as muscle spasms. It also includes intermittent compression, which helps to mimic the muscle contractions, as well as to pump away edema and stimulate blood flow throughout the body, especially as patients are sitting in bed and are non-mobile. This helps to relieve any of those pains and aches. It also includes circumferential coverage, Currently, we are using ice packs, which do not do that. It is just placed on top of the knee, whereas because of the circumferential coverage, it wraps around the whole body part, which increases the surface area and contact for more effective cryotherapy and cold therapy. Due to its faster and deeper cooling, it means safer treatments and minimalized frostbite risk due to the ice, as well as proven reductions in the use of the opioid pain medications that we currently are giving our patients. And lastly, it's portable convenience for patients to take whenever they need to move about in the room. Whereas sometimes if they're moving about, they can't take the ice with them, but with this, they can move about. So next we'll be talking about the budget of the Game Ready GR Pro 2.1. I estimated that there will be about 200 patients per year per campus across 2 campuses that we do these total arthroplasty of knee patients. So about 400 patients per year, which means because they stay at the hospital for about 1 to 2 days, we'll be needing 3 to 4, preferably 4 machines per campus, so 8 machines total. Each machine will cost about $3,000, $2,892.75. So at 8 units, it'll come out to be $23,142 before taxes. There are no other needs for this budget. If we want, the hospital can buy additional wraps so that we can just exchange the machine between patients and just clean out the wraps. But the total will come out to $25,138 for this budget without any other needs. It'll be included by a foundation grant, which I included at the bottom. I actually was working on a grant with Jim, my preceptor, to get these units on the floors. So the grant will hopefully provide everything for this as a revenue source for this unit. If not, the insurance from patients will hopefully cover it or cover what's left of the unit, even though they will not be taking these home. It'll just be a hospital covered budget or revenue. I'll be talking about the staffing later on in this presentation. A couple of values that CPMC has is, again, I went through it before, but the excellence in quality, the innovation, affordability, teamwork, compassion and care, as well as the community and honesty and integrity. So because of the excellence in quality, CPMC has put out a statement that says we exceed customer expectations by delivering premier clinical quality and maintaining the highest levels of safety. We want to keep our patients safe, which means we don't want to give them an opiate overload. So reducing pain medication through the use of this unit for patient safety is a good thing. CPMC also values innovation. So they state that they continually create, seek out, and adopt new ways of providing value to our customers, rapidly moving from idea to execution. So this innovation of a cryotherapy unit from an ice pack with compression will definitely fit that value. Affordability. A lot of patients have to buy these units on their own, and they also sometimes cannot provide it for themselves. So for the hospital to be able to deliver healthcare efficiently by using these resources, as well as reusable sleeves to reduce waste of ice packs and bags, will definitely help our patients be able to afford the care that they need. It also increases teamwork between staff and the patients. Um, it creates more time for the nurses to complete other tasks, as well as it decreases the patient's responsibility to have to provide their own materials or um, really vouch for themselves to get ice packs or to replace um, their ice packs when it's needed. It also fits the bill of the compassion and caring value that CPMC has, which is to treat those we serve with one another with concern, kindness, and respect. Decreasing a patient's pain and their edema is definitely something that nurses always try to do, and it increases our compassion and our care for them. Lastly, we want to increase our patient satisfaction and recovery through their post-op range of motion. And also, we want to decrease their length of stay. A lot of patients will stay a longer time because of their pain, or because of swelling, or because they feel like they're unsafe to go home. So increasing the way that we're able to help them through this cryotherapy unit will definitely make them feel better going home. Lastly, a few key strategies to be able to support the implementation of the proposed changes will be the actors, which is the people who enacts the strategy. This will be the orthopedic surgeons, the vice president of surgical services, the nurses, the representatives of the cryotherapy unit, as well as the patients themselves. Next strategy will be the actions that we use, which are the statements of specific actions or steps and processes that need to be enacted. I'll be going over them in the next slide. The next strategy will be the target of the action, which will be the patients, as well as the staff that are implementing the units. The knowledge about the units, as well as the skills to use that units. And the ability to troubleshoot how to use that innovation. Next will be the temporality of the unit. It'll first start in the PACU. After they come out of surgery, the nurse will place it on the patient as they are waking up from anesthesia, and then it will be brought to the floors, to the med-surg unit or to the TICU, wherever they will be doing the recovery next. The next will be the dose, or the dosage of the implementation strategy, which means how often it will be used. On the unit itself, you can program it to be in 30-minute increments with low compression or no compression, depending on what the patient would like or what the doctors have suggested, and then increasing as needed. So it'll be 30 minutes on with ice, 30 minutes off. Next will be the implementation outcome affected, which means we will be identifying and measuring the implementation outcomes. So whether or not this innovation is used, whether or not there is an increase in patient satisfaction, whether there is a decrease in pain and opiate use, and how the nurses will use the protocols of the innovation. Lastly will be the justification, which is how we will provide theoretical justification of the implementation strategies. And we've done a lot of research, or they've done a lot of research, and the research finds that cold compression devices actually increases the patient satisfaction, while possibly also decreasing pain and opioid use. So the strategic plan will be to implement the cold and compression therapy unit. We'll be implementing it first of all through the verification of the orthopedic surgeons. So our vendors will come and speak to the orthopedic surgeons to help verify the usage of total knee arthroplasty patients. And then the vendors will then, after verification or authorization, will be able to demonstrate and teach the nurses how to use and apply the unit to the patient, while also education and will also educate and answer questions that the nurses have, as well as have teach back to implement the unit and encourage the nurses to utilize it. Lastly, the nurses will implement the units on their own units after the surgery, whether that be in PACU, TICU, or MedSurg. There will be an evaluation of the unit, of the cryotherapy unit, on how it is being received by the patients. This will be through satisfaction reviews from nurses as well as patients. Through patients, we'll be able to see their pain levels, whether their pain needs were met, whether or not they needed opioids, and what they thought of the unit in general. And we'll also be surveying nurses to see whether or not they would rather use this unit or would prefer the ice bags. We would also see whether or not they think that it's helping the patient, or if they hear that the patient is complaining or hearing any needs of the patients. And that is the end of the presentation. So thank you again for viewing this final presentation. If you have any questions or concerns, please feel free to ask and let me know or contact me. Thank you so much. Bye-bye.